Hello and welcome. My name is Amber Polanski, and this presentation will be covering the topic of social anxiety. My purpose statement is to inform my audience on how to recognize symptoms of social anxiety in others, the effect it can have on people around us and our loved ones, and what steps they need to take to help a person with social anxiety. So what is social anxiety? Social anxiety is the intense fear of being judged negatively, evaluated, or rejected in a social or performance situation. It's also known as a social phobia disorder or phobia disorder. Social anxiety is the third largest mental health problem in the world today. Currently, roughly 7% of the world has social anxiety, and out of that 7%, it was totaled that 15 million Americans have social anxiety each year, and the numbers are on the rise. With social anxiety commonly affecting more people globally, it's important to know the signs and symptoms to be aware of, ways to cope with the stressors of everyday life that can lead to a problem of social anxiety. Being a person that struggles with social anxiety daily, I recognize that anxiety disorders are very common in the world we live in today, especially ones connected to social phobias. It is important to me that I can share helpful information for people who are also interrupted in their daily lives by this disorder also, and what's out there for management and treatment. I am one of the 15 million Americans that have social anxiety. What I do for treatment is I see a therapist and I take medications. For example, this medication is diazepam, which is to be used in the onset of an anxiety attack or panic attack. This is my visual aid. My therapist told me that since the COVID-19 pandemic has began, that she has seen a huge increase of anxiety in her patients because people are scared. Sometimes people do not recognize the symptoms in themselves depending on the severity, and this can help you perhaps be able to recognize and help a person with social anxiety. Some symptoms of social anxiety are blushing, fast heartbeat, trembling, sweating, upset stomach or nausea, trouble catching your breath, dizziness, feeling that your mind has gone blank, muscle tension, fear of situation in which you may be judged, worrying about embarrassing or humiliating yourself, intense fear interaction with talking with strangers, fear that others will notice you and look anxious, fear of physical symptoms that you may cause, such as embarrassment, blushing, sweating, trembling, having a shaky voice, me right now. Avoiding situations where you might be the center of attention. There's a couple more if you feel like reading into that. They're pretty similar to each other. Ways that it affects somebody experiencing it. It is seen commonly that people who suffer from social anxiety often self-isolate themselves. They often avoid any gatherings, conversations, and even making eye contact with another. They find it hard to live their everyday life because it is difficult for them to start conversations, reach out for help, and can even be the cause for furthering symptoms if there are other triggers linked to something emotional to that person suffering from it. Even simple things such as walking the dog, going to the bank, ordering food in a cafe, answering the front door, being at a party. There's not no limit on what it could be that can cause a person to have an attack. Panic attacks. A panic attack is a sudden episode of intense fear or anxiety and physical symptoms based on a perceived threat rather than an imminent danger. I'm going to list a few of the symptoms of a panic attack, which are heart palpitations, excessive sweating, trembling or shaking, shortness of breath, feeling of choking, chest pain, discomfort, nausea, abdominal distress, feeling dizzy, lightheaded, feelings of unreality, fear of dying or losing control or going crazy, chills or hot flashes. Complications of social anxiety. There are complications of social anxiety. These complications may include low self-esteem, depression, poor social skills, negative talk, and sometimes have been even known to lead to suicidal behavior, including suicide. Ways to cope with social anxiety. One way to cope with social anxiety could be challenging yourself daily, whether it's a simple task, whether it's a goal that you may have, like just like the other one says, setting a goal. It's getting yourself out of your comfort zone and pushing yourself to do something. The next one is overcoming fears when ready. It says when ready because often people with social anxiety aren't ready to get themselves out there. So it takes a lot of work for them to push themselves to be out of their shell and to go against everything that they know inside to be able to succeed. Another thing known to help social anxiety is deep breathing, meditation, staying active, stopping negative thoughts when they enter the mind. Treatments. The most two common methods of treatment for social anxiety disorder is therapies and medications. There are other, like herbal remedies. There's not just one correct treatment. Every person experiences social anxiety at different severities, and what may work great for one person may not work at all for the next. This is what a person's mind looks like while they're having social anxiety. In conclusion, social anxiety is very real, and with it becoming more common in society, it is very important that we know how to support those around us that are suffering from it. It is very important for us to listen to our friends and family for signs and symptoms when they seem off, because even though they feel off, doesn't mean that they realize that they're experiencing anxiety. Thank you for watching my presentation.